We talk about pre-operative planning for Spiron. Like any prosthesis, pre-operative planning is recommended because of planning offset leg length and exact position and size. You take a normal X-ray and the Spiron is available. You follow the brochure in 10 standard sizes from diameter 18 to 24 and length between 40 and 70 millimeters. The length is measured from here to the end of the prosthesis and the diameter is measured here under the collar. How do you plan? You take the standard X-ray and plan with 130 degrees angle. Of course, depending on the special anatomical situation. Please note that the size of the Spiron, the length of the Spiron, is one part important for the leg length, and second, most people do not consider this, but it's really important. The angle gives a direct effect on the leg length. So if you make a higher angle, you have a longer leg, and 5 degrees make already could make a centimeter or something like this. So consider the planning, and it's easy to make 125 or something, or 130, 135. Depending on approach, there's a special instrument available which gives you exact option to put this angle during the operation. The exact planning, it's recommended that the Spiron prosthesis has a distance to the lateral cortical bone. So do not touch here, make it shorter. And it's not a problem if it's shorter, like 1 centimeter or 2 centimeter even, or just 5 millimeters, but it shouldn't touch. And second, on the planning sheets, it's recommended to take the shortest hairs in the natural acetabulum to restore the original leg length. And the diameter should be as big as possible. You do not have to be afraid, like in other prostheses, that you have a fracture because the prosthesis is too big, because we are not hammering, we are cutting. That is much safer, and during all the operations since 2001, never any fissure or crack occurred. Only some cutting of a very elliptical femoral neck, so this is in daily life not a problem.